The best way to improve knee strength. Hi, my name is Doug. I've been a physical therapist for 30 years, and I specialize in helping people with balance problems learn to walk again. In this video, I'm going to show you the best program to improve knee strength. Sitting knee extension. To do this exercise, you'll need a nice chair. You can do it on the edge of a bed, the edge of a countertop, something which allows you to sit fully. You're going to kick your leg up until your knee is straight, then bring that leg back down again, and then kick the other leg up. Don't do both legs at the same time. You want to try to get a full knee extension, and you should feel your quad muscle tighten up when you do this. The goal for this exercise is to do 3 sets of 10 reps on each leg. That means kicking the right, the left, the right, the left, so you do 10 reps on both legs, then resting for a minute, repeating that 2 more times. In the beginning, you might find that that's just too hard, and you can try to do 3 sets of 3 reps or 2 sets of 5 reps. Whatever you can do in the beginning, just make sure that you feel that it's tiring for you. And then as you repeat this every single day over a few weeks, you'll see an improvement in your quad strength. Pillow squat. To do the pillow squat, you'll need 2 things, a chair and at least 1 or 2 pillows. What you want to do is put the pillows underneath you so their pillows are sitting on the chair so that when you sit down, you're not sitting down all the way. Then what you want to do is cross your hands across your chest and practice standing all the way up and sitting back down. The goal for this exercise is to stand up and sit down 10 times in a row, rest for a minute, and then repeat that 3 times. So you want to do 3 sets of 10 reps without holding on. But in the beginning, you might find that you can only do 2 or 3 times without holding on to the chair. In fact, some people, even with the pillows, they may have to grab the arms of the chair to push off, and that's fine. You have to start somewhere with strength. But the goal for this exercise is to do it without holding on, 3 sets of 10 repetitions. Stretch your hamstring muscles. The hamstrings are the large muscles behind your thigh that help you bend your knee up behind you. These muscles help us when we're walking, standing, and going up and down stairs. The safest way to stretch it is to use a chair. You put 1 foot up on the chair, and then keeping your back straight, you want to lean your upper body towards your leg. What this does is isolates your hamstring muscles and helps you give a safe and good stretch. You want to lean forward until you first start to feel a stretch. Don't hurt yourself. You should not feel any type of pain, especially severe pain in your hamstrings. That means you're pushing too hard. You want to just lean forward far enough that you first start to feel a stretch. Then hold that position for 20 seconds. Ideally, when you're stretching a muscle, you want to hold it for 20 seconds, repeating it at least 3 times. You can definitely hold it for longer, but 20 seconds should be the minimum you hold it for. You want to do this every day until you find that your hamstring muscle is looser. Hamstring curls. To do this, you want to be standing up and holding on to something to keep your balance. Then you want to bend your knee up behind you like you're trying to kick your bottom. So you want to lift your leg up as high as it'll go, and what that's doing is tightening the hamstring muscle. You want to hold it for a second and bring it back down, and then do the other leg. Your goal for this exercise is to do 20 repetitions on each leg for 3 sets. But in the beginning, you might only be able to do 5 or 6 repetitions for 3 sets. You want to slowly build yourself up over time. Don't feel bad if you can't do 3 sets of 20 in the beginning. That's your goal. Pillow step with knee bend. To do pillow stepping with knee bend, you'll need 2 things. You'll need a pillow or something soft to step on, and you'll also need a countertop nearby just for safety. To do the exercise, You want to basically stand on the ground and then step forward, making sure that when your heel hits the pillow, your knee is bent. Then as your foot is on the pillow, you want to shift all your weight to the foot that's on the pillow. Then you want to step back again onto the ground and repeat with the other leg. You want to alternate right leg and left leg. Each time you're stepping forward, making sure that your knee is slightly bent. This exercise will help improve your knee proprioception and help you remember to always step on a bent knee. The normal gait pattern is to walk with your knee slightly bent and not hyperextended. Practicing this exercise over and over can help remind you to do this again. I recommend that you practice this for 5 minutes a day, every day, until you see an improvement. Whenever you walk, you should always have a 5 to 15 degree bend in each knee as your heel strikes the ground. Stepping forward onto a step. To do this activity, you'll need two things. One is a countertop or something sturdy to hold on to, and the other is something sturdy to stand on top of. I'm using an aerobic step. You want to grab the countertop with both hands in the beginning, and then step up, and then step backwards, back down again. Now, your goal with this exercise is to do this 3 times in a row, stepping forward up and then backward down without holding on. But in the beginning, it's fine if you have to hold on the entire time. Most people take weeks, if not months, of practicing this before they get good enough to do it without holding on. Now, when you're practicing, I would recommend that you do this repeating 3 times, 3 to 4 repetitions. So you want to do it about 10 to 15 times a day for you to really see an improvement with it. Doing it more than that can be dangerous, but I would try to do 10 to 15 times as practice with the goal of doing it 3 times in a row without holding on. Backward stepping onto a step. To do this activity, you'll need 2 things. Something sturdy to hold on to, like a countertop or the back of a chair, and an aerobic step or something firm to stand on top of. What you want to do is stand facing away from the step, put one hand on the countertop, and then with the right leg step up and then the left leg step up. You want to have both feet on top of the step and then step forward to step down. Now in the beginning, it's fine to hold on to the countertop to balance yourself. Your goal with this activity is to go backwards and forward, stepping back up and back down 3 times without holding on. Oftentimes, it takes weeks, if not months, of practicing this every day before you're going to be able to do it that well without holding on. I hope you found this video helpful. If you want to see more videos like this, please subscribe to my channel. Are you struggling to walk? Do you have to grab your furniture just to walk through your home? Are you using a walker or a cane to go outside? If so, Balance Foundations can help you. This program is a non-medical approach to improving your balance. It was developed by personal trainers, physical therapists, doctors, and is based on the latest scientific research. This program uses balance challenge activities to improve balance and stability, featuring more than 50 unique balance challenging activities with full instruction and background information. Learn exactly what balance is, how it's lost, and how you can recover it. If you're ready to see a change in your balance and walking, then join thousands of others who have purchased Balance Foundations and have seen a huge improvement in their ability to walk and resist falls.